Good morning, almost good afternoon to our Family Friday participants. We're going to wait for everybody to come into this webinar. So we're going to get started at about 12:01 just to make sure people can log in, get situated, grab your cup of coffee if you're on the West Coast, maybe a little lunch if you're on the East Coast, midnight snack if you're across the globe.
So happy to see you guys here again.
You're just joining us. We're going to wait one more minute just to make sure people can log in and get comfy.
Happy Friday, everyone.
Happy Friday.
Well, happy Friday. Sherry, we should have our countdown to orientation numbers memorized. I mean, they're on all
We should.
next week. If you tune in next week, we'll know the
Next
countdown.
week we'll count down those days. We're gonna blink and it's gonna be here, guys.
All right, we're going to go ahead and get started. So welcome back to our Family Friday webinar series. My name is Sherry Obretz. I'm an Associate Dean in Emory College of Arts and Sciences and happy to be one of your co-hosts for this series.
And I refer to myself as the other Sherry. My name is Sherry Ibrahimi. I work in the housing office and I'm also this summer working as part of the parent and family programs office. And we're so happy to have you guys here.
And just as a reminder, this webinar is being recorded. We will post both the recording and the slides at the end. So if you miss something or we go too quickly, you can always play back. We've also posted last week's our welcome. So if you missed our first Family Friday webinar, we talked about FERPA and access to some of the systems. So we'd love for you to watch those back as well. Today we have a really important topic, especially because we have an upcoming deadline. So today we are talking about immunizations. And we have an amazing guest, Kim Crow, joining us. She's our Director of Nursing and Student Health Services. She's going to talk you through all the ins and outs of our immunization requirements and what you all and your students need to do. As always, we're going to end with some tips and some things that Sherry and I kind of think are great conversation starters and topics to consider with your student before they come to Emory. So we want to make sure that you're in and out and have plenty of time to get on with your Friday. So we're going to turn it over to Kim. Big thanks. We do have actually some additional people behind the scenes who are going to be answering questions in the Q&A. So if you do have a question or something that comes to mind as this presentation goes on, please feel free to type the questions in. And we have a number of people reviewing them and either answering them, typing them out, or we'll answer them live in the chat. So without further ado, Kim, I'm going to turn it over to you.
All right. Thank you, Sherry and Sherry. Glad to be here. I want to just congrats to everyone watching this video, this recording. Welcome to Emory. We have some things to go over today that are super important. I'm going to give you a little overview of our clinic, Student Health Services. We're going to go over all the immunization requirements. We'll review the forms, how to find the forms. I'm going to go through the student portal. And so your student can learn how to access the portal, how to send us messages, how to upload your immunization requirements, how to check your messages. And then we'll go over a few reminders at the end and then give you some time for Q&A. And like you say, Sherry said, if you have a question, put it in the chat and Terry and Callie will be happy to help answer those questions. So Student Health Services, we are located at 1525 Clifton Road on the second floor. You'll see a picture of our building. That entrance there is on Clifton Road, and there's about 66 steps to get up there. If you want to come in another way, the back of the building is off of North Gatewood, and that you'll see the entrance to the 1525 parking deck. And that student can come in that way if they choose, if they're riding or if they're driving. But we are open Monday through Friday from 8:30 to 5. And then we also have after hours. So anytime your student needs advice or sick and has some questions, they can call that number, follow the prompts. We do have providers. We have a nurse hotline that you'll talk to a nurse. And then also if one of our providers need to be contacted, we'll have access to that too.
And Kim, before we get too far, I know you have your website here too. A lot of the information you're going to cover today is on this website. So parents and families or students, if you're on this call, go ahead and bring this website up as we're going through this presentation. That will probably save you some questions in the Q&A. And one other thing I wanted to mention, because we're very acronym heavy at this university, EUSHS stands for Emory University Student Health Services. So in case you're like, what are all those letters? There we go.
Yes, thank you, Sherry. All right, so let's review a little bit of our services. Our clinic will really provide your student with a medical home. So not only do we want to track and give them the immunizations they need, but also we want to be here when your student either needs well care or they need, they're sick and not feeling well. We're here for that too. But we have primary care. We offer sexual and reproductive health. Psychiatry is available. We have registered dietitians to meet with the students to talk about nutrition and health. We have LGBTQ care, gender affirming care. We also have a robust allergy, immunization, and travel clinic. So if your student is a part of maybe a program that's coming up, maybe not this year, but maybe next, that they've got to travel abroad, or if you're maybe just doing something fun for the family, you can come and the students can come and get their travel vaccines here. We do full travel visits to make sure they're safe and have everything they need when they travel abroad. We also have medical records. So if you ever have records here that you want to get after the student years later, you can also access us and we can get you a copy of your medical records. Okay, so let's talk about the requirements and a little bit why we have immunization requirements. We really follow the guidelines from the Center for Disease Control and Prevention and also the American College Health Association. If everyone is familiar with our campus, we are right next door to the CDC. So we really feel strongly about implementing this immunization requirement. And I'm going to go through every vaccine that is needed. These requirements are part of onboarding, and part of the reason we want students to get these vaccines before they come is that when all of the new students come to campus, we want the campus to be as safe as possible to protect against these kind of various diseases. And also, again, if you need information, visit our student health website at studenthealth.emory.edu and click on the immunization requirements. Okay, so I'm going to go over the required vaccines, and these are the ones that you have to have before you come on campus. Is MMR. There's 2 doses of that. Varicella, which is chickenpox, that's another 2-dose vaccine series. Hepatitis B, you'll need a complete series of that, and that can come in a 2 or a 3-dose series depending on which brand of vaccine that you've received. The tetanus, diphtheria, pertussis. That is a vaccine that's you have to get it every 10 years. So a lot of the new incoming students got it when they were 11 or 12. And so be prepared as why they're students here when they hit about 21, they're going to need another one of those. And that usually is around graduation time. Mm-hmm. That's a good one to watch out for. And also students that'll be living on campus, it's required that they have a meningococcal vaccine, the ACWY. And that's you're living on campus, and all the students would be protected against that. The recommended ones that are still very important, although not required, but we do recommend them, and the students can receive those here at the clinic if later on they want to receive it. But it's the meningococcal B, polio, hepatitis A, the HPV vaccine, very, very important. We encourage that. We have it available. We also encourage COVID-19 vaccines, although not mandatory, but it is also recommended. And then we have seasonal influenza. We'll have a big flu campaign coming up in October. And so we'll be giving flu shots out on campus probably for 2 or 3 days. Also, you can get it here at the Student Health Clinic all the way through the whole flu season. So very important. Now let's move through, and we can go ahead and look at our forms. So I just want to point out, so we have 2 sets of forms on our website, and I'm going to go through and show you how to find the forms. But just so right up front, your student coming in will need the non-health science form, and it's in bold red at the top of the page. That is part of a 3 form. So this is the first page. So make sure you pull that one, print it off when you go to your pediatrician, provider, wherever you're getting documented that you've had all these vaccines. Make sure you have this form and take it with you. We use a separate form for our health science programs. They have some different requirements. So later down the road, if maybe your student enters a health science program here, we do have different requirements, and that is covered with that group. So it's 4 easy steps. Like I said, print that form, get it signed and verified, which means it needs a provider signature and a provider office stamp is what we recommend. So that just make sure you have those forms signed, because sometimes we do get forms that maybe the signature is missing, and we will send it back. So take a look at that. There is a tuberculosis questionnaire that's on the 2nd page of the forms when you print them off. Please complete that. You're going to enter all these dates, and you're going to upload this signed and verified form. And I'm going to go through some step-by-step instructions on how to do that. All right. So this is how to navigate the student portal. The student portal is going to be your student's best friend. I suggest that they mark this page, because this is where they will log in and communicate with us. This is our primary way to communicate. So up at the top on the Student Health website, there's a quick links. And if you click on that quick links, the first option is the portal. So have the student click on that. They'll enter their net ID and password. All right, next. Once you're in the portal, it is going to ask to verify the date of birth. So I want to show you, we're going to show a student portal. Greg Dooley is our test patient. Definitely not divulging anybody's personal information, but Greg Dooley is our test patient. So this is the platform that we will be in today. So when you log in, you will see forms on the left-hand side. Click on forms, and you'll see highlighted is immunization form. Click on that immunization form. And then when you get to that form, this is where you have the student is sitting at the computer. They have their form that you got from your pediatrician, from your primary medical doctor, or maybe from a registry from your state. Whatever documentation you have, the student will go through one by one and enter those dates for dose 1 and dose 2. And that'll let you know if you're missing a dose, because we have it populated in there how many doses you need. So go through one by one, enter the dates, scroll to the bottom, and you'll see add immunization record. Now, this is a very important piece. Not only do you need to enter the dates, we're trusting you on the dates, but we also verify. So you have to upload that record, and that record needs to come to us, because when we go in to verify, we check the record that you sent to us. So please remember, if you don't upload the record, we can't verify your dates, and we will send you a message that we didn't get your form. So upload that form by following the simple instructions. And then next. So what'll happen on our end, just so you know kind of what we're doing, it goes into a queue for us. We have a whole immunization team that we work records every day. It'll go into a queue. We normally, like right now, we are running less than 3 days to verify records. But as we get closer to the deadline, which is July 1st, and remember, we have thousands of records coming in, we could be up to 7 days to verify your records. So we do ask that you give us ample amount of time before you reach out to us. But if we've passed some of these deadlines, please reach out. One more thing, when we verify your records, you will see a message from Student Health, whether you are fully compliant or if you're missing something, we will always communicate with you. And now let me show you how to check your messages, because now we've verified your records and we're going to send you a message as if you're compliant or not. So the same thing, you'll log into the portal. There's a lot you can do while you're in there, but just to reiterate, log in, use your password. And then next, you're going to check your messages. So if you look on the left-hand side, click on messages. And now we're in Greg Dooley's portal. All right, so click on messages. And then now you're going to see the secure message inbox. And it'll keep track of every time you've communicated with us. And over on the right-hand side, you can tell whether you have read this message. We can also see if you've read the message. So we will send reminders sometimes. We do encourage you. You will get an email when you have a message in your inbox. So it's real important to go in and read your messages. All right, next. So let's talk about how to send a message to us. Let's just say you have a question. You're not understanding something, and it's all about immunizations. If you'll look on the right, you click new message, and then you'll send a message to the immunization compliance team. And also, while your student is in there, let's say it's not immunization related. If you see all the other choices that we have, I mean, for medications, we have travel related questions. You need an appointment, things like that. You can message us. We have a lot of options. So click continue. Okay, and then the message now is going to come to the immunization compliance team, and then you're going to just type in the box your question, and then someone will get back with you.
Kim, we have a good question that I would love to answer live right now about the forms. We have a family who says their pediatrician will only complete their own forms. They won't complete other people's forms. They do sign it and stamp it. Is that a acceptable thing to upload as an immunization form?
It is. If you get a record from your primary doctor, as long as it is has a signature on it, the location of it, we will accept other records. Yes, that's correct. Good.
Awesome. And this actually came up last week too, as we're talking about uploading things. We have a number of parents who have asked about a healthcare power of attorney form. Is that necessary to upload? And if so, where would that get uploaded?
They could upload that also to, actually probably the best way to send that would be to send it to the immunization mailbox. Okay,
so we can put that in the chat as well. Is it immunization? It's an email address, yeah?
It's an email, immunizations-shs@emory.edu.
Okay.
And we can upload the healthcare power of attorney to the chart and make a note.
Thank you so much. That came up last week as well.
All right, so let's look at, and we're in the portal still, and how to check your immunization status. You're just curious, you sent your records in, maybe you didn't read your message box, but let's look. I'm just curious, I want to see. So you click on the left-hand side, it says immunization status. So if you see on the PowerPoint here, you'll see meningococcal has an X. So that can mean mean we don't have documentation, or maybe you uploaded it and hadn't been verified yet. So if you have a green check, you're good to go. If there's an X, there's still something going on. And it could be that it's in the queue. So it'd be another just to look back and like you say, wait for that message to come through. So let's talk about some next steps. Maybe you are missing records that you just can't find it. Maybe you don't have proof of that varicella, just something. You can, once you find that missing vaccine or receive that missing vaccine from either an outside entity, you know, a private physician, or maybe you had to go to CVS or a pharmacy. That is a great resource for immunizations. You would also submit that record through the immunizations-SHS website. The portal is actually the recommended, but if you can't get it to upload that, you can just send it by the email address. We also encourage you to make an appointment with the immunization nurse once you're on campus. If you communicate with us, we are very glad to work with you one-on-one to set an exemption status so that we can maybe give you a vaccine when you get here on campus. So we are going to have 3 clinics during move-in week. So Monday, August 14th, we're going to be over at the Student Center from 10 to 3. We'll be centrally located. It's going to be a walk-up clinic. There's no appointment required. Bring whatever records you have. We'll have our computers there to check your student health record. So we can take documents there, or we can also check your status if you're curious. We'll be there on Monday and Tuesday. Please drop in if you need to see us. And then we are going to do a little something different this year. On Saturday, we are going to have a shuttle bus that's going to bring students over to student health. This is a great way for parents to see when your student's not feeling well. And I've been there. I know that when you have students away from where you're at, you're used to having them close by, but it's good to see where your student will be taken care of. And I'd love for parents to come over, get on the shuttle bus, come over here. We're probably going to have some goodies and treats and give a little tour. And I think that will give you a lot of confidence and just make you feel better as you're sending your student away, to know that they'll have somewhere to come and see some friendly faces, some excellent providers, excellent nurses to take care of them while they're not feeling good.
Kim, before we move on to kind of some questions and things to ask, I've just been thinking, and you brought up some really great stuff. So the first is the student health portal. And we talked about this a lot last week about what parents can log into versus what students can log into. It is called the student health portal. So really your student has to be the one that's logging in with their net ID and their Emory password in order to upload all of this. And we realize as parents and families, you might be the owners of these records, or you might have been managing all of these things as well. But really your student is the one that should be logging in, and it's the same for when they're sending their messages and reviewing those messages as well. When you're sending messages to the email, the immunization-shs@emory.edu, Kim, I imagine some parents might be emailing that as well. What information should always be included to make sure that you're attaching or verifying it's the right student? I would imagine name and student ID, or
name, date of birth, and student ID are 3 great identifiers that would really help us. And just for parents to know and students, we try not to reply back to the email address. We usually copy and paste that email into the portal and then reply to the student in the portal. So that is just a way to bring the student back to the portal for the communication. But the email address is a great way to communicate with us.
And Kim, it brings back yet another thing that we kind of talked about last week, and as we're going to continue talking about over the next few weeks, that your student is the primary person with whom we communicate. And we know that that's a transition for a lot of parents and families. What we've been hearing too sometimes is parents saying, we didn't get the information. And so one of the questions you can ask your students first is, did you receive an email? Because as Kim has said, and as we said last week, we're often communicating through the student's email. Over the summer, we do send communications both to the Emory email and to personal emails, but starting in August, once students are on campus, we only send official communications through the Emory email. So your students should really get into the practice of checking that Emory email at least on a daily basis over the summer, every few days. But that's something really great to get them taking some ownership over these tasks.
Correct. And one other thing, if there's students coming that are not reached 18 yet, the student will need to log onto their portal and print the parental forms, print those out and have the parents sign it. It's like a consent for treatment. There's a lot of consent forms, and we call them compliance forms on the portal, but anyone under 18, their parent would have to sign that. So the best way to do that is print it, have the parent sign it, and then send it back through maybe the email address or upload it through the portal.
And again, sorry, Kim, before we move on, and we should have said this at the top, we are specifically addressing families for Atlanta START students this fall. There have been a few questions for Oxford START or Oxford Spring START, and we're so happy you're here with us. Oxford has a Family Friday series, and they're covering a lot of these topics as well. If you go to our webpage for Family Fridays, there should be a direct link to their Family Friday series as well. Spring Start might have some different dates. So Sherry and I unfortunately don't have those specific details. But if you go to the Oxford welcome page, and we can put that in the chat as well, somebody from their office should give you the correct information. We just don't want to misspeak for the different campuses. But so happy you're joining the Emory community as well. All right. So Kim, I didn't mean to steal your thunder, but it's a great transition to helping your students adult. And Sherry and I jokingly, we weren't sure what to call this section. So this is new for us, but every week we really are trying to highlight some of the topics and conversations that you as parents and families can start having with your students now. And we've kind of previewed a little bit of this. One, having your students log into these accounts. Two, having your students check their Emory emails on a regular basis. Those are really, really important. But Kim, you also have some other things that you wanted to highlight for your students as well.
Yeah, I just want, I want parents to know, and students, the student's the primary patient. This is a good time to talk with them on how to schedule appointments. I would advise them to put our phone number, just put it as a contact, because when you're not feeling well, the last thing you want to do is scramble for a phone number. So go ahead and have them put it in there, label it as student health services. You can call and make appointments that way. You can ask to speak to a nurse that way. There's a lot of options to do. So really encourage that. Submit the required documents early. And early is now, because the deadline is just right around the corner. But I didn't talk a lot about holds, but there would be a hold placed on the account if you're non-compliant. And a hold means that you can't register for classes. So that's a really big deal. Students are very anxious, want to get those first picks. So get all the required documents in and let's get it verified so they can move along their way.
Kim, I'll share a few stats with you just so you all know. We're so happy. We have 45 people joining us live today. So if you can get your immunizations in now, your forms, yay. But we have over 1,400 new students starting with us in Atlanta. And I think student health is still waiting for over 1,200 forms. So you're ahead of schedule. They're not due till July 1st. We know that it takes some time to get into doctor's appointments. Students from across the country are all trying to get into their doctors to get these forms kind of filled out. But really, if you can make sure that you are getting those in by that July 1st deadline, it'll make everything go more smoothly. The other thing is we realize sometimes doctors are out of town or not responsive to you, or you might not have access to some of these immunizations, especially some of our international students. So Kim, if that is the case, if you cannot get in touch with your doctor, your pediatrician, or you do not have access to something before the July 1 deadline, what should our families and students do?
So there's a couple things you can do. One, I would recommend, most states have a state registry of vaccines. So children received vaccines from the day they were born. And so you could contact your state registry. In Georgia, it's the Georgia registry. We call it GRITS, but other states has their own registry. You can actually, and in all states, you're pretty much required to submit documents to your state when children receive vaccines. So you can request records from the state registry. If you just can't get records, titers are always optional, which is a blood test to check immunity for varicella, MMR, Hep B. Those are all blood tests that are options. The biggest thing is just communicate with us. We know that everyone runs into situations, lose records, can't find them, can't get access. Send us a message, talk to us, tell us what's going on. You know, we work with everyone individually. There's always extenuating circumstances. And then we have our moving clinic that we can get you caught up. So just communication is the key.
In this helping your student and adult category, parents, I'm with you. We've filled out these forms for camp, right? Many of you have done this every summer. We are familiar with the immunization form. What I would like for all of you to think about doing differently now is really have your student own this checklist, that awesome checklist that Kimberly showed, where it's green when you've done it, where it's red if you still need it. You know, your role at this point, ideally, is to make sure they've seen this, and then let them know, you know, here's what you got to do. Reach out to your provider and get them to fax this form and upload it. This is great practice for you, because starting in August, it's, you know, you're going to be in charge of your own health care. I'm not going to be there. And so I think it's just great practice.
The other thing that we hear a lot, and actually this was a great question in the chat, Kim, is my appointment is after July 1, or I just don't have all of my things, so I'm going to wait and send everything late. So for student health, would you prefer, one, that things are just submitted as you have them, and then to follow up with an email to say, hey, these are coming, or we have to wait until we come to campus? Or, you know, I think, and you can confirm, it's better to let student health know where you are in the process, upload what you have, and that way we know you're not ignoring us. And I think that student health keeps really amazing records of this. I know people like to just get the green check mark and be done with it, but actually submitting nothing leaves you with lots of red check marks. So.
Correct. Yeah. Just if you submit what you have, and let us work with that, that'll start the conversation with us. And that way, because we'll email you back and say you're still missing this, you can just let us know right away. So as long as you engage with us, we're really big on engagement, which is really part of being an adult, of not, things just don't go away. This will not go away. It will be there. So communicate with us, reach out to us, call us. Certainly, we want to be here for you in the good times and the bad. When you're not feeling good, please come and see us. We have a lot of options for care. Our student health clinic does amazing things, and we want to make sure you're taken care of.
And Kim, I loved your suggestion of having our students save the student health phone number in their phones now. I think that's great. Many of your students might have never called the doctor on their own or been able to send a message on their own, right? They tell you that their throat's sore, they have a fever or something, and you've done that for them. So getting them really comfortable. I know I've worked with students for a long time. Using a phone and calling might not be their preferred mode of communication. So the fact that you have sending the messages through the portal with like loaded categories is really, really awesome. And so again, logging in with your student, just showing them how easy it is to send a message. We're preaching to the choir. We know that at this point, but it's really great to get them started for that. There were some questions in the chat about health insurance and whether or not students should go to the student health versus other providers. Our next few sessions, and this is kind of a good lead into what's coming up, are going to go over some of these topics. So next week, we have Kim's great colleague, Tammy Kim, talking about health insurance and the different options. She'll also go over kind of when you can go to student health services, when you need to go to a different provider if you don't have Emory insurance. After that, we're talking about accommodations. So if students have either medical, emotional, or other accommodation needs, how to register for those. And then on June 30th, we have a whole session called Transition of Care. And that kind of brings together all of these topics of what is best for your student, when you need to set up external providers in Atlanta, when they should continue to see people at home, things like that. So just wanted to preview a few of the things that are coming up in the next few weeks. So hopefully you'll tune in with us again.
Yep. Thank you, Sherry. That was, I think, very good. And also, I put my email address. I'm always available too. I love to talk to parents. If you just have a burning need, you can't get your question answered, but feel free to reach out. Thank you everyone for attending. We look forward to your student being on campus and having a great college experience.
Thank you, Kim. Thank you so much. This was really, really helpful.
Thanks,
I always
Kim.
learned a lot as well. I wish I had the student health portal when I was in college. It would have made it a lot easier. All right, we're going to stop our recording. Hopefully we'll see many of you next week. As a reminder, these will be posted with the slides. But Sherry, Kim, and